Hey everyone, thanks for tuning in. Today we are having a nutrient spotlight on Myo-Inositol. This is an amazing kind of pseudo vitamin that is good for a variety of conditions, but mostly for those on the PCOS spectrum who might be dealing with insulin resistance. So it's not exactly a vitamin, it's more an isomer, but if it was considered a vitamin, apparently the family would be B vitamins. But to break it down of exactly what it is, an isomer, kind of like a sugar alcohol that we can use as energy. Now, it doesn't produce any kind of rise in our own blood sugar, and apparently it does the exact opposite. It is able to lower our blood sugar levels by allowing our insulin to work better on our cells. So, in saying that, most of the research is on women with PCOS who have insulin resistance. So it can be super helpful for those with high androgen levels, so high male hormones, and we can bring those down. And those with high male hormones may have hair growth on their face, their nipples, their body. There may be acne, cystic acne, or just acne on the cheeks, upper back, chest. Trouble with weight gain, trouble with mood. And so it can really be helpful at a dose of about like 2 to 4 grams for these kind of conditions. And on the reverse side, it's not as good for people who have low androgen levels for the same reason. And low androgens can be something that affects our fertility and our hormone levels, so we have to be careful about that. It's been shown in various IVF studies to improve the egg quality, the embryo quality, the implantation, again, for women with PCOS. So if you are somebody who has been diagnosed with PCOS, then you know this one might be great for you. The problem is, a lot of women have PCOS or on the spectrum for PCOS and they don't know it because it hasn't been absolutely diagnosed. PCOS can appear and disappear. So you can have cysts, but then they go away. Or you can have irregular periods and they become regular. You can have trouble with weight gain, or you could not, right? So you could have some or all of the symptoms. So it's sometimes hard to know. You can get blood tests done, but most of all, I suggest observing it more symptomatically, and that's how it's diagnosed, like irregular cycles, trouble with weight gain, heavy craving for carbs and sugars, mood disorders, trouble with fertility, a high AMH or egg count. These are indicators that you may have PCOS or may have insulin resistance. So Myo-Inositol, great for PCOS, but if you haven't been diagnosed, then pay attention to some of those symptoms and see if maybe you fall on the spectrum for that. I find myself prescribing a lot of Myo-Inositol for people who don't have a diagnosed condition of PCOS, but that I can tell from their symptoms that they are on the spectrum. Hope this is helpful.